Dr. Eric Buchart is a retired British cardiothoracic surgeon who has spent 35 years operating on patients with mesothelioma. I had a chance to sit down with Dr. Buchart to discuss his experience and his expertise in the treatment of mesothelioma, along with his development of the staging system used in the diagnosis of the disease. This video is divided into a series of sections on specific topics. If you have any additional questions, you can visit our website at www.mesotheliomacarecenter.com, which offers information on mesothelioma.
There are basically three different types of mesothelioma. The first and the most common is called epithelioid. The least common is called sarcomatous. And then there can be tumors which have a mixture of both cellular types. Now, the importance here is that we're going to mention in a few minutes that there's a difference in prognosis. But from the pathologist's point of view, these tumors, the epithelioid tumors, can be difficult to differentiate from secondary adenocarcinoma. This is a tumor in another part of the body that has spread to the lining membrane. And in the case of the sarcomatous tumors, they can be difficult because they contain a lot of fibrous tissue. They can be difficult to differentiate from benign fibrous tissue or scarring of the pleura. So we'll talk about that a little bit later, but it's important for the pathologist really to have a lot of experience in looking at mesothelioma and looking at these other asbestos-related conditions in order to make the correct diagnosis. I think what I wanted to emphasize in this next slide is the difference in prognosis between these different types of mesothelioma. And I think it's very important that patients are aware of this and something that they must ask their doctor what type of mesothelioma this is. The epithelioid tumors, the pure epithelioid tumors, carry the best prognosis in terms of the effects of treatment. The sarcomatous, unfortunately, carry the worst prognosis, but these fortunately are the least common types. They're probably less than 10% of mesotheliomas are this type. The mixed are the intermediate ones, and here the prognosis is also intermediate between the best and the worst.